Okay, Peter, tell me, what kind of problems were you having when you first came to the office?
Oh, I had spent about probably almost 20 years having extraction here and there, and a new crown, and root canals, and all that kind of stuff. And I finally reached the point that I said, I'm going to do the complete lower dental implant. And that's what I just recently had finished.
And what was it that kind of motivated you to consider that? I mean, it's a lot of work, it's a big expense. What was it that kind of got you going?
That I was still having problems with the roots that I had left under the bridges and the crowns. So it was like it was an ongoing process. I was always having to do something. So it reached the point where, based on infection and other problems underneath those bridges and crowns, that I said it was just worth my while to have the implants done.
Right. Well, and I know in your case, as far as the justification for the top versus the bottom, from an expense standpoint, you were able to just do your bottom only, and then in the future, when you're ready, you can do the top. So how did that work out from you from a standpoint of cost or ability for you to do it?
Well, I got the whole bottom done. I had enough money to pay for that. So I'm going to do the upper as a complete denture. And then in the future, when I can afford the next round, I really look forward to doing the whole top as an implant also.
What would you say to people that are kind of contemplating the kind of problems that you were having, some of the frustrations, and they're just not sure if it's the right thing or the right time to do it in their lives?
You'll know when the time comes, when you reach the point that you are tired of doing all those things, and you know you're going to have to keep doing more in the future. It's so obvious, and it was not difficult. I don't care what anybody tells you. The process was absolutely easy between the entire extraction and all the process of putting in this new implant. I'm just amazed at how easy the process was.
Yeah, that was a big concern. I know we had initially.
Yeah, absolutely.
It went a lot smoother than you thought.
Yeah, I mean, having the whole thing out, I thought it was going to be like major surgery, because it was actually bone scraping, and I had huge tori that had to be chipped out, and that was a terrifying thought. But I think maybe it was a 2.5-hour process, or even less. I didn't even take a pain pill.
That's great.
It was incredible.
Well, good. Well, we're real proud of you. We're looking forward to you completing your treatment. And it's been a pleasure working with you during the whole process.
Thanks. Actually, it's been my pleasure.